Hey guys, thanks for watching my videos so far. I hope they've been really helpful for you. And in this week's video, I have a special treat for you guys. I will be discussing my favorite way and the best way to use my favorite tool of physical therapy, the foam roller. There are so many great uses of a foam roller, everything from improving your posture, improving the flexibility of your spine, and addressing painful conditions that relate to a lack of spinal flexibility, such as thoracic outlet syndrome, pinched nerves in the neck, and other conditions of hypomobility or a lack of flexibility in your spine. I hope you find a lot of value in this video, and be sure to hit the subscribe button. So first, to begin, there are two different ways we can use a foam roller to help to improve the mobility of your spine and posture and improve quality of life. Rolling parallel to your spine and perpendicular to your spine, and I'll be covering both in this video. So to begin, if you're rolling perpendicular to your spine, that's where I find most benefit. That's what I'll be starting with. And what I mean by rolling perpendicular, well, you take your foam roller and you lay it in this position, not parallel, but perpendicular to your spine. Following that, what we want to do is place our mid-back. Our mid-back is where we normally hold most of the tension, and that's kind of where we hinge forward and develop a lot of spinal stiffness that kind of pulls us forward as we age. So that's mainly where we want to focus with the use of the foam roller to get the most benefit. So what you want to do is lay it on a firm, flat surface, and then start by placing your mid-back right over the foam roller. From there, we're trying to lift our hips and then roll back and forth, looking to find the most tension. Now, right off the bat, I would be very cautious rolling your low back. Again, the foam roller works best to roll more of the mid-back, so just be cautious with your low back. Also, I would never want anyone to use the foam roller who has low bone mineral density, osteoporosis, or even osteopenia, or any kind of bone condition that would affect the strength of your bones. The foam roller can be quite tough on the spine, and so it's really best for younger or middle-aged individuals who have good spinal health, just quite a bit of stiffness. So again, you want to roll first, and you're really looking for where's the most tension in your spine. Once you've found where you're the tightest, or at least one of the tightest spots, sink your hips down so your buttocks comes to the ground. And I like to put my hands behind my head. It all does increase the amount of pressure on your spine, so just be careful with it. Another option would be arms down by your sides. And then you're doing what's called a foam roller crunch. So really the goal is to roll to find where you're the most tight, and then be working on the foam roller crunch, either with arms down by your sides or up above your head. We're trying to move slowly, always following the pain rules. No pain past 5 out of 10. No pain lasting longer than about a minute when you stop the exercise, if it does create any pain. And if you're violating either of those rules, it's too much for you. I would contact a local physical therapist and go about addressing your spinal stiffness in a different way. But after you've done about 10 crunches in a spot, I would re-roll. Rolling is in a way we can think of as your assessment technique, trying to find out where is most of your tension located. And once you find that out, then again, place your hips down and work another set of 10 crunches. Again, these helpful foam roller crunches. Now, I personally do these before I go to sleep at night. And I really find that it really helps to allow me more of a deep sleep and less back and neck soreness, especially if I'm lucky enough to be able to sleep in one day. And plan on spending about 5 to 10 minutes on a foam roller. Now, in addition to improved posture through improved spinal health and mobility and improved sleeping ability, It can also help to address a lot of spinal pain, especially from stiffness. Yet another helpful technique, after you've been rolling with the foam roller and you've been working on some foam roller crunches, what I like to do is use a thick pillow to rest my arms and my head on so I can take some deep breaths and really breathe into that stretch. So what that's going to look like is placing the foam roller, again, perpendicular, pillow down, firm flat surface. Roll with the roller, find your tightness, and once you've been working on those foam roller crunches again, then get the pillow close so that you can cross your arms over your head and sink back into that pillow. So the pillow is taking the weight of your head and your shoulders and your arms, and you can just deep breathe into that position. Very relaxing, especially if you're choosing to do this late at night before you go to sleep. I'm going to hold for 30 seconds if you choose to work on extended holds with the foam roller crunch. Okay, so although perpendicular rolling is one of the best ways, you can also roll with a foam roller what's called parallel to your spine. This is more for getting the shoulders back and to work on what's called spinal stability or spinal alignment. Yes, if you work at a computer throughout the day or a tablet or other device, that's just really pulling our head forward, rounding our shoulders, and resulting in what's called kyphosis, or a bending forward of the mid-back or thoracic spine. So that's, again, what a lot of the perpendicular rolling is about, is helping to address that and bring that spine up. Parallel rolling is more about rolling other tension in your spine, which I'll cover, but there are two key exercises that can be really helpful for spinal alignment. So to do that, we are just placing the foam roller parallel to the spine this time, like so. And then you're going to sit on the very bottom so your head can rest on the top. Now, quick side note, there are different types of foam rollers you can buy. What I'm using today is what's called a high density foam roller, which is pretty intense. So, like I was saying earlier, foam rollers can be intense on the spine. So I only want people to use this that are younger or middle-aged and who have healthy spines. So no bone disease, nothing like that. It's too much of a risk that you might fracture your spine when using the foam roller. And if you are younger and middle-aged and your spine is healthy and you've been using the foam roller and it just seems like it's too much with a high density, there is a white type of foam roller that's much softer, much more comfortable that you might like. This is an example of a smaller foam roller that's much softer that sometimes I'll bring with me when traveling. So after that, you just sit on the very edge, rest your head back, and then the first thing you can do is roll with the foam roller. It is easy to roll off the roller, so just be careful, but just trying to roll out that tension, similar to what we were doing in parallel. So just rolling side to side. If you find a really tight spot, you can just kind of hold in that position for 10 to 30 seconds. I mainly use the foam roller in parallel for the two key exercises, the first of which are called snow angels. So what this helps with is getting the shoulders back and working on that spinal alignment. Yes, if we strengthen while the spine is stabilized on the foam roller, and by having the knees bent, we're keeping the spine in a nice position, you can actually help to strengthen and stabilize yourself into an improved position. So that's part of what the snow angels are all about. So just moving back and forth. If you choose to do the foam roller both directions, this would be a nice warm-up. So snow angels. Second exercise is for the lower body and more core, and that's called a supine march. Both exercises are pretty easy to do. So if you're having pain in your spine, hopefully they'll work for you. You can use your arms down by your sides to add a bit more stability, make more of a stable base. It's perfectly fine. So this video has been all about what's the best way to use my favorite physical therapy tool, the foam roller. But there are so many different topics I could post about. It all just depends on what you guys would like to see. So please post your comments below and subscribe so I can do my best to create a meaningful video for you or for a loved one to improve quality of life. This is Dr. John Mayo, physical therapist, really hoping that this program is helpful for you or a loved one and improves your life.